Okay, one more. Our video, a short one dealing with exercise and its effect on the heart and some disorders, particularly heart disease. So input from proprioceptors and sympathetic nervous system. So before, if you're thinking about going out for a jog, your cardiac output has already gone up. Your heart rate goes up, and once you start moving, proprioceptors, it stimulates the sympathetic nervous system, and your cardiac output goes up. Muscular activity increases venous return and preload in right ventricle. So your superior inferior vena cava constrict, pushes more blood back to the right atrium, more to the right ventricle, and cardiac output's going to go up. Stroke volume will go up, therefore cardiac output will go up, and your sympathetic nervous system will be fired up, and so that's a positive chronotropic agent. So both you got positive chronotropic agents and positive inotropic agents that will increase cardiac output on both sides, increased stroke volume and increased heart rate. So sustained program of cardiovascular exercise. So when you talk about cardiovascular exercise, you are stimulating your oxygen delivery system, the strength of your heart and the number of blood vessels that are going through skeletal muscles. You don't make big skeletal muscles, but you can make a larger heart. And remember, you make a larger, stronger heart, not by adding cells to the heart, which would be called hyperplasia, but just having larger, stronger heart cells. That's called hypertrophy. That'll increase stroke volume and therefore lower heart rate for the same cardiac output. So when you're resting, and you still have to put out over 5 liters of blood every minute, if you have a larger, stronger heart, stroke volume is higher than other people's, so your heart rate goes down. As I mentioned, trained athletes sometimes can get their sustaining heart rates are in the 40s, sometimes even high 30s. Okay, disorders. So here we are with disorders. The big one is coronary artery disease, sometimes just called heart disease or cardiovascular disease. Atherosclerosis, accumulation of lipid deposits that degrade arterial walls and obstructs the lumen in the coronary arteries. How does this happen? What happens by damage to arterial wall? However that might happen, sometimes just inflammation, or sometimes certain chemicals that damage the inside of the wall. And remember what happens, therefore, you might start to be attracting platelets to the inside. We made a prostacyclin on the inside of the arterial wall prevents platelets from sticking. You damage that, and platelets might be on a stick, and then monocytes adhere, become macrophages. They start to absorb cholesterol and fat and become something called foam cells. And again, adherence of platelets, secretion of growth factors that lead us to more smooth muscle and fibroblasts, connective tissue that starts growing inside the blood vessel and starts to decrease the size of the lumen inside the blood vessel. So this is going to limit how much blood can get supplied to the heart muscle. So these are called atherosclerotic plaques, and we all have a little bit of them as we grow older. So it's accumulation of lipid, fibrous connective tissue, smooth muscle cells that occlude the lumen. Once you get to a 75% occlusion of the coronary blood vessel, and of course this could happen to any blood vessel, not just coronary. So that's why you can talk about cardiovascular disease. My nephew had a complete occlusion of one of his carotid arteries. So it can happen anywhere. And if it happens in the brain, it can lead to to strokes. It happens in coronary arteries. It leads to a myocardial infarction, a heart attack. And if it occurs in other parts of the body, you can kill tissue in other parts of the body. And so it's pretty serious. So if you get 75% occlusion of a coronary blood vessel, leads to angina, which is pain. And the pain is not here, right over your heart. That's heartburn. The pain is up close to your neck and down your left arm. That's angina. That means your heart's not getting enough blood. The inflammation is plaque. This plaque can break off and lead to a fatty embolism, which can go down, be pumped down into a coronary blood vessel and block the whole coronary blood vessel down farther down downstream. So inflamed artery walls replaced with scar tissue that is not as elastic. And that's arteriosclerosis, hardening of the arteries. And we get a little bit of hardening arteries just as we grow older, because our elastic tissues are not elastic much anymore. They don't bulge out. So it's a smaller opening, higher blood pressure. That's why people's blood pressure tends to go a little bit higher as they grow older. Risk factors and prevention. All right. How can you avoid a coronary artery disease? Well, some are unavoidable. Genetic, for example. When we get into the nutrition chapter, we'll talk more about blood lipids, LDLs, HDLs, VLDLs, chylomicrons. LDLs are the bad type of cholesterol. They are a direct risk factor to coronary artery disease. And some of us take statins to reduce them, including myself, to reduce LDLs. How do you get high LDLs? Well, don't exercise, be a couch potato, eat too much fat, eat actually too much food to begin with will lead to LDLs. Gender. Males have a higher risk for coronary artery disease than females. I think because we don't handle stress as well. Stress is one of the avoidable things, but we all have to encounter stress every once in a while. And stress is a strange thing. Intermittent stress is like a good thing. It helps prepare your body for hard times, like not eating for a couple of days. That's stress. And that actually helps prepare your body. Some people think a better way to eat is to fast for a couple of days and then stuff yourself the next day, like our hunter-gatherers do. That's stress. Exercise is stress. It's intermittent stress, but constant either emotional stress or physical stress constantly all the time is actually a bad thing. So stress is a good thing when it's intermittent, bad when it's constant. Age, something you can't do anything about. The older you get, the more time for plaque to build up, the more chances for things to go wrong, and the less elastic your tissue is, and so that's something you can't change. The older you are, that's one of the risk factors. I go to my cardiologist and say, what are my risk factors? And age is one of them, and they give you a number, and the older you are, the higher your number gets, and the higher your risk. Okay. Things that are avoidable. Obesity, one thing. The larger you are, the more stress on your heart. The next chapter we'll learn about one of the things that affect blood pressure is how many miles of arteries you have in your body. The more arteries there are, the higher your blood pressure has to be to push blood through those extra tissue. Smoking. how many things are bad about smoking. Let me count the ways. And that we used to think about lung cancer and stuff, but cardiovascular disease is right up there with one of the things that will kill you, that smoking will help kill you. Lack of exercise, as I mentioned. Poor diet, high saturated fat, high carbs, not just high carbs, but high processed carbs. That's probably even more worse for you than high saturated fat. They're both bad, but so that's poor diet. Eating a lot of fruits and vegetables and lean meats. Anxiety and stress. Anxiety is emotional, mental stress, and as I mentioned, long-term chronic stress very bad for you. Really leads to inflamed arteries and atherosclerosis. So intermittent stress good, long-term chronic stress, whether it's mental or physical, not good. So those sometimes you can't avoid the stress. Hopefully you can avoid. And that's it, folks, for heart 5. And matter of fact, that's it for the heart chapter. So see you later, and we'll start up the last cardiovascular chapter in a bit. So see you later. Bye for now.